I'm going to take charge. I'd like to, on behalf of the Evening Rounds team, I would like to welcome you to tonight's session. It's always great to see so many people at Evening Rounds and a lot of new people and some people who we see often, so it's great to have you here. We have a few new people helping us on the Evening Rounds team, and I thought I would just quickly introduce you to them. We have Devin Hagg from the BC Center for Disease Control, who has been helping out, as well as Janelle Chung and Julia Weiss, the Signals team. And tonight, we're really hitting it out of the park because we also have two of our executive sponsors presenting. So Robin Sussel from Signals and Justin Karasik of Providence Healthcare. So I have a few announcements to make before we get started. We will spend the majority of our time listening to the presentations, but I thought I would go over a few things with you. Our presentation will go until 7 p.m. We'll have a quick Q&A for 15 minutes and some closing remarks and reminders tonight. This is Evening Rounds. This event did grow out of healthcare and social media, Canada-wide group, so we do encourage you to live tweet the event. You can tag us at Evening Rounds, and you can use the hashtag eRounds and HCSMA. HCSMCA. I need a larger font, please. And there's some other handles. There's Providence Health. Do we have these? Can we just put them up somewhere? Yeah, okay. So there's some other things up here to connect with. We have Wi-Fi. It's Evening Rounds. No, sorry. Thanks. We also are videotaping the session. And we'll share the videos on our website along with photos from tonight. You can check the website and review all of those things. The Q&A at the end. So if those of you who are unfamiliar with how the lecture system works, what we ask you to do is there's a button by your microphone. So when we get to the Q&A, if you'll raise your hand, I'll call on you. Just press your button to speak. And when you're done speaking, hit it again. And that way we'll be able to hear you and it'll be recorded on the video. So. As always, we would like to thank our good friends and presenting partners, Providence Healthcare, who have provided us with the conference room for Evening Rounds for tonight's discussion. That said, tonight we're going to be talking about digital strategy and specifically the strategy that Providence Health has put together. I always think it's funny when you talk about social media with people and you talk about digital strategy. I think what we're really talking about is a human strategy because our challenge as communicators has never changed. The job that we have to do is to really connect people, to listen to people, to share information. And so our digital strategies are really building on the same old human strategies that we've always had. But we do have a lot of new ways to reach and engage people, and that's what you'll hear about tonight. Providence has developed this strategy to guide their online efforts and those of their related organizations, and they'll discuss staff engagement, crowdsourcing new ideas, and demonstrating transparency to patients, staff, and stakeholders. They're also going to feature their emerging digital tool, which is Bloom, and I'm sure many of you here have checked out Bloom. This is an online hub that helps people inside and outside of Providence get to know the organization better, and it hosts a discussion area about health issues and the care experience that Providence provides. Justin is the Director of Communications and Public Affairs and Media Services at Providence Healthcare, and he has more than a decade of healthcare experience. And he strives, like most of us, to make the most of limited resources by developing cross-functional projects for Providence, its affiliate research organizations, and its foundations. He's involved in projects across the Lower Mainland and with other healthcare authorities, and he's a strong advocate for social justice and has a keen interest in the future of digital health. And interesting, when you look at Bloom today, I looked at it again after the initial launch, and I was really moved by how frank and bold the discussion is, particularly around the heroin ruling. And what was fascinating to me was to see a number of people from all different spheres of healthcare, from staff members to physicians to other people, weighing in on that debate and supporting Providence for taking such a bold stance. So that is a remarkable thing in healthcare. Healthcare, by its very nature, is somewhat conservative, and to be able to tackle those issues head on is really great. So we also have Robin Sussel with us, who will be speaking, and she joined Signals in 2001 and has helped Canadian health research and science organizations clarify their messages and communicate with audiences to achieve measurable results. She's a pleasure to work with if you've had opportunity to work with Robin and Signals. Before joining Signals, she worked for 10 years as an in-house communicator for a national HIV clinical trials network, where she connected community advocates with HIV research community. Robin received an honors BA in communication from Simon Fraser University and a master's degree in media studies from Concordia University in Montreal. So without further ado, I will turn it over to Justin, who is going to take you through the digital strategy. Thanks.
Thanks, Daniel. Good evening, everybody. As Daniel said, I'm Justin Karasik, and I work here at Providence Healthcare. And you're actually sitting in St. Paul's Hospital, which is one of our 16 sites. It's actually our flagship of our organization. So we're actually, Providence Healthcare is one of Canada's largest faith-based health organizations. And people are often surprised when I talk about faith-based or Catholic roots, considering that I'm Jewish. So you can see we're very multi-faith and very accepting of all different types of religions, cultures, people, and everything. So this digital strategy is an opportunity for us to kind of reach all the diverse stakeholders. And so I'm going to try to be quick. I often go along too long, so I've asked Janelle over there to just hold up things and try to distract me if I go on. So without further ado, I'm going to get us started. So what Robin and I are going to talk about is give you a high-level overview of Providence's digital strategy, which was officially launched in June of this year. Can everybody hear me? Okay. And then we'll have the opportunity to drill a little bit deeper and actually go into some of the digital tools and channels that make up this strategy, including, what's that? Ah, there you go. Thought they were saying my fly was undone or something. Nope. The digital guy doesn't know how to work the computer. No problem. There you go. There we go. Good. So we also I really want this to be an opportunity to go over some lessons that we've learned along the way so far, because we're really in our infancy in this stuff. We have got a long way to go, but I know that a lot of other people and organizations in this room are also along this path, so we hope that this will be helpful. We also hope to maybe have some time at the end of this to actually get some ideas from the crowd on where they think we can go with this. So, and then of course we'll open this up for questions. So what exactly is a digital strategy? So a digital strategy is a detailed plan to integrate and organize an organization's online activities. The goal of a digital strategy is to allow an organization to listen, engage, and communicate, and to build a community around issues and values that the organization cares about. So what a digital strategy, it includes all social media channels, websites, mobile strategies, online newsletters, that kind of thing. It's all of it all together. And you've probably heard a lot about digital strategies, as there's some big ones that have just been launched, such as the City of Vancouver just launched a digital strategy. The BC Ministry of Health has a digital strategy. TELUS has a strategy. The Mayo Clinic, of course, has a strategy and a digital strategy, and there's multiple other organizations that seem to be going in this direction, including many in this room, I'm sure. So why does a healthcare organization need a digital strategy? So there's so many reasons, and this is where I've got to really just keep it short, because I really want to make sure that we leave enough time to show some of the tools and discuss the strategy in more detail. But what we're seeing is that social media and digital strategies clearly aren't a fad, as some people told me a couple of years ago, or they said this is going to go away, or what I still hear is, oh, you mean the stuff my teenage daughter does, and that kind of stuff, which I hear over and over again. So it's not a fad, and it's actually going the opposite direction. And not only are, I think the stat from Pew Research Center is that I think 73% of people in North America are going online to find information about their health conditions or their treatments, et cetera. So people are going online more and more. And it's not just the youth. It's actually the fastest growing segments are in the I think it's 55 and older is the fastest growing social media users. And it's just each of the various tools and social media tools has different audiences. And we're seeing, less of the very young using Facebook, and they're moving on to other areas. But so it's kind of dividing up the various tools, and they all have different purposes. But one reason, besides, even though that we see that some of the older folks are starting to use these tools, we also know that the baby boomers, we've been hearing this for years, that they're retiring. They don't seem to be going, but they're still here. Go. And anyways, but with the changing workforce, we're seeing a new generation of people and future leaders of tomorrow. And these are people that are digital natives. They're the Generation Ys or millennials that are going to be the leaders of our organizations in the future. And these new employees are accustomed to being connected at all times, documenting their lives in transparent digital form, and receiving instantaneous replies to tweets, posts, and comments. When they want something, they usually want it now. And it's crucial that employee engagement caters to this key characteristics of this emerging group of employees. Because current methods are often static, unengaging, and top-heavy. I'm thinking surveys, still important, but you do a survey once a year that's not really going to give you the results that you're hoping for, that this group wants to see. And we need to recruit and retain these people. So it's very important that we go there. Again, Canadians of all ages are using digital media, and they're searching for health information. They're annoying the heck out of their doctors because they're coming in knowing so much about their conditions and self-diagnosing themselves and just getting them to write them prescriptions. And healthcare providers have been slow to step up, leaving the public with little information available. And that's, healthcare is so leading edge in so many different areas. We know with technology, procedures in the clinical setting, but sometimes we're not really that up to speed, at least here in BC healthcare, when it comes to some of the technology solutions for engagement and communications. That's polite. So we also know that there are several groups on Providence Healthcare that we're already active on social media. Our centers, our research centers and foundations, we had various groups, Facebook groups emerging from different departments, units, but no unified strategy to group them all together. And there's also was a lot of conversations happening about our organization online, and these conversations are going to happen anyways. So if you're not online kind of monitoring them and participating, then you're kind of missing a key opportunity. And the last thing, last reason I'll give right now is that I was getting calls once a week or more from people wanting to get online, getting their department engaged in social media, and most of the time I had no clue what to say to these people. So I knew that our department had to get up to speed in this area because it wasn't going to go away. And so that's kind of some of the reasons why healthcare organizations should get involved, as well as why Providence got involved. And another reason, I guess, is that we also did a staff survey about a year and a half ago. And we had a sample of about 744 people that responded to our survey. And as you can see from these stats that taken a year and a half ago, that 47% of staff plan to increase the usage of mobile devices at work. 83% thought mobile devices are beneficial in a healthcare setting, and 45% of those surveyed perceive social media as beneficial in a healthcare setting, and 76% of employees already use Facebook and other social media tools. So as this is a year and a half old, I would guess that we'll probably see a lot of growth in all these areas if we were to survey again today. So, and then the final thing that actually said, okay, you guys got to do something, is that we had an old website for many years. I think we had 7 years, 8 years. We hadn't updated our website. It looked terrible. It was, top of our list every year. This is what we need to do. But unfortunately, in healthcare, fortunately, I should say, that all the money tends to go to clinical care and then serving the patients. So making the case for things like this is often hard, even though it does have a direct impact on patients. So we were given some one-time funding to do a website. And so that's where we got involved with Signals. And Signals started to question us too, like, is this the right opportunity maybe to look broader? Not just a website, but a digital strategy as well. And so after I understood what a digital strategy was and started talking with a few people about it, we realized that this was the right direction to go. So what are our objectives of our digital strategy? So we have 4 main objectives I'll go through pretty quick. Objective 1 is to serve our patients, residents, and their families and develop communities around their needs. So one real kind of tangible thing that we see happening more and more and that we're encouraging is that if you're part of a patient population suffering from a chronic disease, you get offered education and support group sessions for you to come in physically and talk with staff and other people suffering from these illnesses. So, but because Providence also is a provincial resource for many disorders, especially around, when it comes to our cardiac care services, we thought, why not take some of these forums and go online? So, online groups started popping up on Facebook. We have a ventricular assisted device patient closed Facebook group, and this is a group where people that suffer from that have had to have these heart pumps installed get together and they talk, they share support. There's health professionals that kind of lead these sessions, again, sharing resource tips, photos. And what we're seeing from physical support groups can improve health outcomes. We're also seeing that the same goes for these online forums. So a couple other groups we have one for Pacific Adult Congenital Heart Group patients that go online to talk. We also have internal ones like Mount St. Joseph Medicine Program. Their staff has a Facebook group where they get together and share resources. There's things like our 40th anniversary of our nursing school has a kind of another online community where they're all planning. They just recently had their 40th anniversary when they graduated as nurses, and they all got together to share everything from what are they going to wear at those sessions to these events to what are they doing with their lives now. Okay, so the second objective is to be known as a healthcare provider that values compassion and social justice and is an organization where research and innovation are of global caliber to benefit the BC patients. And I'm going to talk about that at the same time as I talk to Objective 3, which is for us to be known as an international leader in the 6 populations of emphasis that our organization puts a focus on. That's kidney care, HIV, heart and lung, seniors care, and urban health and mental health. So why do we want to build the profile in Canada, where we're not we're not supposed to be trying to earn profits for this kind of stuff? So what's the point of trying to increase our reputation in these areas? So we could be out there and be known for everything and be totally, look no different than any of the other health authorities or health organizations. But when it comes to things like recruiting and retaining the best staff for our organization, we really want to be known for certain things. for bringing in more research dollars and fundraising dollars and being given kind of making the case to government to run certain programs and such. You really want to be seen as having a niche. As well, patients are having more and more choices now of which facilities to go to. You can decide, well, I had a bad experience at VGH, no offense. So I'm going to go to St. Paul's. And they're not only just talking about that, they're sharing their good and bad experiences online. They're rating their physicians, they're rating their hospitals. CBC now has a report card where they rate your hospital. So it's very important that we have this reputation, that we build this reputation so that patients want to come, that we can serve the needs. As well as we want other health providers throughout the province to say, Providence, they do great cardiac care. Let's make sure we send our patients, refer them over there. The last objective I'll talk about here is probably the most difficult objective to fulfill, but it's key to the continued success of this strategy. So that's to build organizational capacity around social media and leverage all our affiliated channels to aid in meeting Providence's strategic plan and strategic directions. There's multiple opportunities that fall. We're going to talk about some of these opportunities specifically throughout the presentation, so I'm not going to get into too many of them here. I'll say a few, but crisis communications. A lot of people are using social media for crisis communications. We were home to the Stanley Cup riots recently, and so we definitely used Twitter when everybody was coming to St. Paul's to correct misinformation that was going on in the media. Someone was tweeting that we were closed for business. Again, thank you, VGH. And others were just, anyway, so we got out there to correct the misinformation and to be there for parents who were looking for their kids and wondering what was going on and wanted to update what was going on downtown. So as I'm getting the cue to move faster, I'm going to go. The risks, we're all familiar with the risks, but privacy, we hear this over and over again, and in healthcare, this is pivotal. And the reason that we can, what's that? Sorry, question?
We just did a privacy quiz for
Yeah.
PHSA.
Okay, and what was your?
I got 80%.
Oh, you got 80%. Oh, nice, nice. Well, this is often the thing that's usually throws a lot of the things we want to do off, because they say, privacy, this is going to be a huge disaster for privacy. And knock on wood, we haven't had any privacy breaches since we've launched our social media strategy. And we think that this is being mitigated by, strong social media guidelines and policies, and as well as moderating our channels. The U.S. Army is on using social media channels. So, they should be the most concerned about it. Yes, exactly. So, I just think with about 3 years ago, we weren't even able to access Twitter. So we've come a long way. Lack of uptake. This is, people actually jumping on board, and this continues to be a challenge, and we'll talk about this more, but we do think that these could be addressed through more education, workshops, training, and capacity building. Very public conversations. Again, people are worried, what are people going to say about our organization? Let's hide it behind a firewall. We don't really believe in that, because we believe that if we're communicating to our 10,000 staff anyways, through newsletters or other internal forums, or that information is basically public. Anybody can share that with anybody. So it's kind of a myth that things are kept private anyways. And we want to be known as a transparent organization. We want people to know, if there are challenges that we have, as long as that we're addressing that and we're looking at ways to make sure these challenges don't occur again. I think people generally understand that. Lack of resources is a big challenge, and we'll get into that a little bit. Pace of technology change, huge issue, and again, we'll talk about that near the end of the presentation. So there are risks you can see, but we believe that there are many more organizations and many more opportunities than risks. So I'm going to turn things over to Robin, and she's going to talk more about how things are working.
Hi, everybody. It's World Toilet Day. Happy World Toilet Day. I found that out on Twitter, so it must be true. I'm just going to talk to you a little bit about how the strategy works, and what you're seeing on this slide is how all digital strategies work, not just this one, where we start with seeds and it moves outward. I think in this context, what you really need to know is that, and it's why we called this presentation "Blooming from the Inside Out," is that the seed that we've identified are the staff of Providence and all the associated people, of whom there are about 10,000. So the idea is that the seed is the staff and their connections, their family and friends and their coworkers and their colleagues outside of the organization will become the advocates for the seeds, and then they will influence patients, and then the patients will influence the larger community, and within the larger community, we can also lump government and other people that we really want to influence to think positively about this organization. So in doing the digital strategy, working through it, we really needed a way to bring everything together. The digital strategy lived on paper at first, and I think that's a real challenge in digital strategies, is how do you get from the concept into something you can actually implement, and that's where a lot of organizations get hung up. So we looked at what our assets were. We knew that 30% of people were really highly engaged online, and that's 3,000 people. That's a good starting point. We also knew that many organizations within Providence already had their own social media channels. They were online anyway, but we had no way to connect them to Providence in a meaningful way. So we started talking about a dashboard. And like the term digital strategy dashboard has been thrown around a lot, so we had to also make that more concrete. So in the end, we developed what we call the social dashboard, and we ended up naming it Bloom. And this was a really important moment because it actually helped us bring everything together. Now, the purpose of Bloom, I just want to outline really carefully, because originally this organization was founded by a network of sisters, and they would go out into the community and talk to the people they served about what they needed and what they thought and where the gaps were in care. And so we've sort of been thinking about this as the modern version of the sisters going out into the little communities and asking the various populations, and that's kind of been a thread for us, which has been kind of cool to have that sort of image. So the idea is that the purpose of Bloom needed to kind of take from that route and move forward. So obviously, coordinating the online presence of all the various organizations was critical. We also, the purpose of Bloom was to have sort of a central place where to communicate to staff. And I was actually at a meeting with Justin just last week, and somebody called Bloom a virtual water cooler. And I immediately wrote it down, and I've been using it ever since, and not crediting the person who came up with it. Actually, it was Lori, Lori, the head of HR. Anyway, so it's for communicating with staff, and it's for generating ideas. And we've sort of been loosely calling it crowdsourcing, but it really is for generating ideas and acting on the ideas that are generated. And we talked about leadership and transparency. I think just by putting this online and doing what Providence is doing, they're able to show the transparency of the organization. It's also supporting staff engagement, and there's a very large part of the human resources area here at Providence is all about the engagement. And with that, of course, we get the benefit of retention of the staff that we're engaging with, and also recruitment from the others looking in to the organization and saying, this group is really connected, and they really talk, and they're really open and transparent. This might be a kind of place I want to work. And then, of course, communicating the corporate messages, which Justin talked about. Oh, wrong button. Well, I think at this point, before I get to this, I want to show you Bloom. And I'm going to go Command-Tab.
There you go.
Brilliant. Okay, Bloom looks like this. I'm going to show you the video. It's a 1-minute video, so it won't take very much time. We have a topic at the top, and as you scroll down, you can see various types of content related to the topic. And then we have this ideas and action area where we can actually show what we've acted upon and demonstrated to the people who have weighed in on certain topics, what we've done to act on their suggestions. And then we have an archive that goes through. There's 2 up, and then you can go to more of the archive if you want to look at all the topics. So I'm going to give you a 1-minute video snapshot of Bloom.
Welcome to Bloom, a place where healthy ideas grow. Bloom is the social media hub for the Providence healthcare community. We've gathered digital conversations happening all over Providence, from our treatment and care teams to our foundations to our award-winning research groups. They're all here, blossoming in one online location. In this environment, you can learn about us, share our stories, and comment on all you see. Bloom is also home to a discussion area where you can listen, learn, and plant your own ideas about how to improve Providence healthcare. Join the conversation.
What happened? Buffering? Is it buffering?
No, it thinks it is still playing. There you go, now press play.
Stations. Tell us what you think and help us cultivate the best care, research, and teaching possible at Providence.
Okay, Command Tab again.
Yeah.
Okay, and so when we started this process, we developed Bloom as a channel, and then Providence already had all of these other channels. So we took care to brand them all, tying them together so everybody would know it was from one organization. And for us, and for Justin, certainly the most exciting potential of this whole thing was the discussion area of Bloom. And this area is driven by a tool called Discus, which is used by many of the main newspapers like the Globe and Mail and the National Post to facilitate their discussion area. So it's a plugin that we use to.
It's a free tool, I believe.
It's free, and it's great because you can not only you can weigh in, but you can also vote ideas up and down. So I think the long-term plan is that when we can get more people on the system, those top votes will help us to identify which are the main ideas of interest. So this is just an example. I mean, really, the very first week, we were talking about what else they could do for their series, Providence in the Park, where they go down to the downtown east side, and they bring in food and clothing for people and various things. And so we were soliciting ideas about what else could we be doing in the downtown east side. And one of our staff people said, "Well, why don't you ask the people in the downtown east side what they want?" So, well. She didn't think of that, so we did. We went out, had a discussion with them, and they said one of the ideas they came up with was that people in the downtown east side have very little ID to begin with, and what ID they have is kind of beaten up. So what about laminating their ID for them so it could last longer? So I think that was like one really concrete suggestion that we were able to implement. There was a couple technical glitches with that, but that's something that's going to become part of the Providence in the Park. From year to year. So that's just a really early example of something that we could actually act on. And I know a lot of you here are wondering, well, how does this work day to day, and what does this do for workload and all of that kind of thing? So day to day, what Justin's team tries to do is integrate as much as what they already do with the content that goes on Bloom, and vice versa. So all the stuff that's used on Bloom is repurposed in other places. And as the workflow continues, they're doing less and less of certain things and more of other things, leaning toward the digital side. So content planning is something that is required when you've got a digital strategy. And for this content or a digital strategy, we're using themes. So there's World AIDS Day, there's Heart Month, all of those kind of things. External to your organization is sort of an area or a theme. But also within an organization, you might have an event, or you might have something that you want to focus on, like flu season. And in the case of just a little last week, the Salome trial and the court proceedings that are coming from that. So that's an example of a theme.
One thing just to add to that point too is that the themes all we try to have them all come around our kind of organizational key messages. Those, again, going back to the objective 2 and 3, what we want to be known for. So there has to be kind of a tie in there as well as, so that's kind of just how we make sure that we're just not talking about World Toilet Day or whatever the theme of the week is.
What do you have against World Toilet Day?
Oh, no.
So, and the way, we also have a working group within Providence, and some of the people in this room are part of that working group, where the communicators from all the various organizations, the foundations and the research organizations, come together and they bring themes forward that are important to them. Content production follows that, and content production has always been the most time-intensive thing, long before digital ever came along, you know. So I know a lot of people complain about the amount of time it takes in digital, but it's been ever thus. We just have more to complain about because I guess, you know, it feels like a hungry monster that always needs fed. So once you do it, you got to get it up and organize it. And once you start talking to people, you need to, and people ask you questions, then you have to go into the organization and source the answer. I mean, that takes time. And also just the day-to-day responding directly to users. So those are all things that take time. So for this to run successfully, we needed to put in place some very specific tools. Providence already had social media guidelines, which was great, but that's not absolute essential. We put together a content strategy, and that included developing key messages for the content, then voice, tone, and manner. And that's when you have an organization with a lot of people in it, and there's a lot of people involved in the social media, you need to know what voice you're speaking with. And so that document allows you all to know where you're coming from and how you're speaking about the organization and interacting with people. We also created an online content calendar, which is a Google Docs, which everybody who's involved in the content feeds into. We have an issues mitigation protocol, and that was really just building on an existing, you know, every health authority, all of you know what that looks like. We just built on it. And then, of course, we needed a very solid measurement and analytics plan so that we can see how we're doing at various points along the way. And then we needed to put in place online and in-person training for the organization. We've already done a lot of leadership training, and we'll be doing some more training with the groups within the organization. So the one thing I wanted to mention was that for a digital strategy to work in any organization, you need to tie it back to the priorities, the strategic priorities of the organization. And if you don't do that, you're going to find that you're not going to get the buy-in of the people that you need to buy into at the leadership. So Justin has spent a lot of time talking, and these are the 5 areas that Providence has identified as their strategic priorities. So we spent a lot of time talking to the leadership about how the digital strategy and Bloom in particular can help them achieve each of these priorities. And this is a process. It takes a long time for people to switch their gears from paper and the way they've always done it to thinking about, well, you know, now that we have this tool is up and running, how can we use it? How can we take advantage of it? So this is really like a pivotal point in your digital strategy. Is what you want to do is connect it back to everything the organization prioritizes. And now I think I'm switching it to Justin. Justin's going to talk about an example of how this all works.
This is your water, Robin. Just realized that. Okay. And one thing I just want to say about content development is that you shouldn't always be thinking that you have to create all new content. So content exists everywhere, and a lot of it's still relevant. You may have ran with it a year ago, but it's still very relevant. So you can repurpose content, whether it's video, photos, articles, etc., as well as we become curators of other people's content. So, you know, there's some of you guys, we share your content. We give you guys credit for it, of course, but it's another way to kind of share stuff that fits within our theme. So don't necessarily think that you have to create all new content. So you guys are sitting in the very room where last week our organization did what we feel is the right thing. And I'm going to try to really quickly explain what we did. We have been doing, with joint with UBC, a clinical research study where we're trying to find alternative treatments for those people with chronic heroin addictions who aren't benefiting from what current treatments already exist, such as methadone. So we're comparing 2 medications in this study. One of them is actually medically prescribed heroin. And what we are hoping to find is alternative treatments. We do already know that heroin prescription heroin works, because there's been 6 international studies done around the world that have found this is an effective treatment for treating the 10% of heroin addicts that haven't benefited from any other treatment. And so when we say effectiveness, this is meaning that they stay in treatment longer, they use less illicit heroin, they commit less crimes, they have better health outcomes. And often in some of the studies, one I think in Switzerland saw that actually 45% of those heroin users in the program actually were able to get off heroin. So the research is solid. There's all throughout Europe, countries are using heroin-assisted treatment. And here in Canada, as the study is still ongoing, but we're starting to see some of the participants finishing, because it's done in phases. And so the participants finishing that are doing very well on some of them on heroin-assisted treatment, we asked the federal government for compassionate access to keep them on the drugs as a life-saving treatment. And Health Canada did the right thing, and they said yes to the first participants, the 21 participants that came out of the trial. But a few days later, the federal health minister got out there and said that her own agency, Health Canada, had made a mistake and that she changed the rules and this would no longer be allowed. So we took the bold move of getting one of Canada's top lawyers that also represented the Insight battle, and we have 5 brave patients of the Salome trial came forward, and together we are going to try to, last week in this very room, we launched a constitutional challenge to overturn the federal government's decision that prevents the delivery of this life-saving medication to those extremely vulnerable patients. Anyways, that's the backup. The reason why I'm telling you this here is that we were able to not just do a regular strategy to support this, but we also tried to take advantage of our digital strategy to more effectively make our case. So we still did all the, leading up to the announcement last week, we did all the usual things, such as press releases, development, press conference, we held media training, backgrounders, and briefing notes, all that stuff that we all do in this room. We sent press releases through to wire services to get that information out. But this time, we also decided that we wanted to use our digital tools to get the word out. So we developed a very detailed electronic press kit that was hosted on a web page of the Providence Healthcare website. And within this press kit, we had videos, photos, pre-written social media posts, background information, Q&As, links, quotes. And then we sent, within our press releases and also personalized letters to various online influencers, we sent them information about what we were doing and saying, here, go online, read more about it. So sending them to the most accurate source of information. Okay. So there was lots of different digital assets that were created, shareable graphics, relevant photos. When we were media training our CEO who spoke to the media, we just took 30-second video clips and stuff of her and used that. And we were really focused on coordinating messaging and developing Q&As, because this is not an easy challenge. We're talking about heroin, which is the most stigmatized drug out there. And we're also talking about a conservative government, and we're also talking about, very people that they're very emotionally attached to the idea and have emotional reactions. So it was very important that we got the right information out here. We focused on the science that exists and the experts that kind of can speak to that. So we also had live tweeting going on from this event. There was tons of reporters and other stakeholders that were tweeting. And we had, again, pre-planned posts for our social media channels that went along with that. And then we were monitoring and engaging and replying to the various things that were coming through on social media. So, and then After the announcement, we continued to build on the content by using quotes from the press conference, photos, videos, and then media coverage, because there was a lot of media coverage despite Rob Ford having a show of his own. Other things we did is we had hashtags, we developed our own. We looked at terminologies that would be maximized using search engine optimization so that we knew which words to put in our posts. So when people search for heroin addiction, our electronic press kit would come up early in Google. And we also used Bloom to actually have a theme, which if you guys go on later tonight or whenever, you'll see. And there again, we have videos and pictures and various other pieces of content that support the campaign, as well as a discussion topic about what people think of our constitutional challenge. So some of the results of all this stuff that we did was the media coverage so far has been very accurate and consistent with the messaging, which for such a complex and emotional topic, we were happy that accurate information was getting out there. There was, as far as traditional media, there was well over 40 media mentions outside of just republishing the press release, so unique kind of media coverage of the incident. And they actually did their homework. They went to the electronic press kit and they read up on the Q&As, and there wasn't a whole bunch of misinformation that we had to go out and correct. There was also on our announcement tweet, 71 people clicked on that. 22 people liked our first Facebook announcement. There's been lots of different activity after. The announcement alone got 20 retweets and 22 likes and reached 7,528 people on Facebook. So that's that one example of just one way we were able to do it. This slide deals more with how are we going to measure the impact of the entire strategy. So we, of course, need to measure. Healthcare is very, outcome focused, and you should have measurements for everything so that you can, say why this is important that we continue doing it. So we're measuring all our social media channels, including Bloom and the Providence Healthcare website. We are measuring this digital strategy in 4 main areas in terms of growth, engagement, visibility, and sentiment. We're using a baseline from May 2013, which is, we launched the formal digital strategy June 1st, so kind of to see some of the stuff prior to the launch. And then our next results are coming in, the 6-month result rate in sometime in December. So we'll be seeing that. We've seen little indicators of how things are going and such. But really, the point of our measurement to us is improvement. This, again, is just a beginning process, and it's ongoing. And what Robin and others remind me often is that you really have to be patient. This type of change takes a lot of time to happen, and there are a lot of people that are resistant to change. They're used to doing things their way. And although I've noticed the stats say that the fastest growing groups are those in the 55 plus, we're still having the most success in some of the younger folks getting on there and using it. And I think it's not out of not wanting a desire or an interest from some of the older stakeholders, but it's more that they just need a bit more hands-on training, which is what we want to be able to provide for them. Okay, so this is very just around our social media channels, 3 to highlight, where we have some measurements here for you guys. June on Twitter, you guys can read these and see there has been significant growth in these areas since we've put a focus on them. Barriers and solutions. So I said I would come back and talk about some of them. Technology. This is one of the biggest ones. I'm not sure if this is across the province, but for sure in the Lower Mainland, we still use Internet Explorer 6, which is less than 1% of the world uses Internet Explorer 6.
We use it as in
a browser, like for your staff and such. So we have been lucky in that that at Providence Healthcare, we finally got some support to download Google Chrome. So we are now have dual browsers. The reason why we're stuck on Internet Explorer 6 is because it's tied to some of our older clinical systems that will be updated as we continue moving forward with our clinical transformation projects. But right now, there's still a lot of people stuck on Internet Explorer 6, and you can't do anything innovative or new using that technology. So it's even Microsoft has a countdown till the death of Internet Explorer 6. So the 1% that use it, they're all here in BC Healthcare. Staff fear, confusion, hesitancy. That's again, it's just, it's new. We're asking our staff to get online and talk about us, answer questions, and do it in a way that they don't have to agree with what we're saying. They just have to be respectful. So it takes, it's taken some time for people to get out there and make their comments public. And because this is a public platform, not an internal thing, some people are worried about that. So just through more education and again, getting the leadership on board to say, hey, we support this, we agree with this. We have our CEO now tweeting, and it's actually her tweeting, not anybody else. And promotion, okay, the other big one, which a lot of people will have the same concern here, is around capacity and budget for some of this work. And on the Providence communications team, there's 5 of us and one graphic designer. So we have a small team. I've had a request for a digital and social media specialist for 2 years now, but there's because of budget and everything, rightfully so, has to go to clinical care first. We'll continue to be on that list right now. So that's where we are continuing to look at. Signals has been helping us with a lot of these things. We're empowering others, because the idea is not just for communications departments to be in charge of this. It's also to empower the staff and the physicians and those people that are already online to get out there and start tweeting on behalf of the organization, using our guidelines and policies and all that kind of stuff. So just one thing about training. Again, training is going to be big. We've done a lot of training sessions, but we're now going to be offering them over the next 3-4 months to all staff. We're going to videotape them. We're going to have online training and such. And we're also looking at getting feedback from people and saying, hey, what can we improve upon? And we're also really trying to show leaders that we're not creating new work here. We're asking you to look at your existing projects and work and say, hey, how can Providence's digital strategy help with that? So if you have a new project or initiative that you're launching, why not ask staff as just another way of engaging them about, what do you guys think about a new professional image policy? What do you think? Dress codes at work. What is your opinions of this? Tell us. And anyways, actually, a lot of people are very supportive of that. You go online and read about some of the comments. I was surprised by that too. But anyways, we are. What's that? No, it's no, not necessarily. But because I'm running out of time, I can't get into the nitty details. But that's what we're asking them to look at your existing work. Also, if you're really promoting leadership within the organization, use Bloom. Let's have a campaign on leadership and showcase all the great leadership things that are happening. And so it's happening, but it's happening gradually. We have more and more people getting on Twitter, more and more people getting on Discus, but it's happening, and it's going to take time. So where do we want to take it? We've got lots of ideas about where we want to go as far, but I'm really interested in the crowdsourcing piece specifically because I just think that that's a powerful thing to actually hear the voices of all our stakeholders, not just internally, but our patients, our other partner health organizations and research groups, to hear and get their input. And we want, in the future, we may look at gamifying some of these things, maybe by having leaderboards and stuff for people that actually contribute more often and that kind of thing. But we're kind of have to keep a moderate pace. So we do have 20 minutes left. what I'm hoping to do before we break into questions is to actually hear from some of you guys, whether you have any ideas on where Providence Healthcare could take Bloom or our crowdsourcing in general. If anybody has any suggestions, this is a very knowledgeable group, so feel free to let us know. Anybody? Let us know online if you don't. If you,
Okay, it's a concern and a question. It's two things. Your target audience beyond staff is your patient community, and you deal with a lot of people who are marginalized. So have you done any research into how many of those people actually have access to the tools that you're providing to give their voice to the conversation? And the other question was around, you're asking people to use the tools to tell you how they can improve the tools. So that's kind of a self-selecting group of people who are already using the tools. So have you got strategies for reaching those people who aren't yet using them?
okay, I'll answer both those, and Robin, feel free to throw in anything. We haven't done any formal research on the downtown east side or some of those more marginalized groups that we other than what we hear from our stakeholders, and actually we have been getting comments online from a lot of them. So that's reassuring, but as far as formal surveys, no, we haven't done that. We do know that there are lots of cell phones available, and there's community centers that have computers and resources available that are set up. But no, we want to actually, go do that research. The other thing is that we don't think that people are all going to go to Bloom every day, and so we're using our other channels that are traditional channels to redirect people to Bloom and our digital strategy. So our newsletters, our website, posters, in forums where we have groups. The nice thing about these specific questions is they have a specific URL that you can send directly by email or wherever, and people can comment directly from that, so they don't have to log on, and they can also do it anonymously, and we encourage that as well if people don't feel comfortable putting their name out there. So definitely, we also use all the other social media channels where people are already living, where they're using Facebook, they're using Twitter and stuff, and we try to promote them and bring them back to Bloom for certain reasons. In other cases, we try to keep them on our Facebook page. So again, it's part of a multi-channel approach. And when we talk about a Bloom theme, like let's say leadership, we try to complement that with our media relations strategy, our internal communication strategy. So you're kind of getting hit from everything, and it feels like a theme focus. And we try to do at least 2 of those a month.
Any questions or comments?
I had a question. Should I? Yeah.
Yes.
Turn it on?
Yeah.
Does that work? Okay, so I'm at PHSA as a health economist, and when we do cost effectiveness analysis, we try to see how much extra life years you got out of an intervention and what was the cost. And if you compare that per life year to the GDP per capita, you could say we extended this person's life and it was less than the GDP per capita, so maybe they could provide more growth than that, so it was cost effective. And I wonder if you had a similar kind of metric for like the cost per click, when you're doing your evaluation and we got 22 clicks and it cost this amount of money, is that a good level of investment? Did we go over or under?
The years of life loss measurement is kind of set up for health economy, and
Yeah.
there are very few kind of structured measurements like that for this field. It's really
course.
emerging. So what we'd like, we have targets in our measurement strategy. So those targets are somewhat arbitrary, but they're at least targets that we can judge our own success against. And then, every day, Justin and his team are looking at things they can do less of versus things that they can do more digitally. So, at the end of the day, it may be sort of like an FTE kind of thing. Can one FTE do, more on digital than, pushing paper around or putting posters up in the elevators? So, I think the equations are not set for us, but those are all things that we want to look at.
I just want to make a couple points to that. First, Robin, I told you so there would be detailed metric questions. The second thing was that we are, again, looking at everything we do in communications and trying to evaluate the effectiveness and not just do things because we've always done them a certain way. And also looking at, we use volunteers now. We used to put posters up ourselves, but now we're using volunteers. Why didn't we think of that many years ago? We also, students and such, we've brought our great social media policy and guidelines were developed primarily by leadership by a student. It was a summer project that worked with us and so we're trying to find creative ways to resource these things because it is an ongoing challenge. And also we want to bring more people in the tent and say, hey, you know, we have a ton of tools for you to use in documents for your organization within the Providence family and sometimes beyond, such as, UBC or Michael Smith Foundation. You want to have a campaign that's similar to what we kind of believe in, and you have some content. Here, you have access to our thousands and thousands of people audience that are captive. That's all they do is look at Bloom all day long. So, okay, that was an exaggeration, yeah.
Can I just continue this a little bit? Sorry.
Would you, microphone, please?
Thank you. I didn't hear from anybody about earned media, and I think that's a really important part of this question. When we look at cost effectiveness of an intervention, we have to really look at actions that someone's going to take and that person's salary versus what sort of comes back. Earned tweets, that's things like retweets, things like clicks that are not using paid media, which in this case I don't think was the case. Is a very, very different animal. So getting just that general outreach, getting people on board, getting people to agree with you can actually earn quite a bit of free publicity and free additional communications, which is very difficult to measure, but also really, really helpful. Yeah.
And we unfortunately never did any paid advertising in healthcare, but other things.
In the back.
Before I ask my question, I just want to make sure I understand something about Bloom. It is it's an aggregator of a number of different Twitter accounts that are internal to Providence Healthcare. Is that correct?
It's an aggregator, part aggregator of Twitter, Facebook, YouTube, Flickr, and our other social media channels of our various, we have research centers like the Center for Excellence in HIV/AIDS and CHAOS and the James Hogg Research Center, and we have foundations like the Tapestry Foundation, St. Paul's Foundation, and those, it's an aggregate of those. But it is also this crowdsourcing piece as well, where that can be, we could have hundreds of questions on there that are all, again, where we want to empower a process where we can actually look at things that are actionable, that we can go work with the leadership on and say, hey, look at all the comments that came in. Is this anything that we can act upon? And so for every communication strategy we do now, there's always what can we do with our digital strategy to complement our other communication strategy, pieces of our strategy.
So my question is, based on the aggregation of all of these accounts through a central repository, which is Bloom, are you able to actually use data analytics in a way that you couldn't to create learnings based on the historic looks across all of the various accounts that you are tracking? So I take Twitter as an example. I know Twitter, for example, through its API only lets you access 1 week's worth of data. So you obviously, if this has been up for 4 or 5 months, if you're storing that data, you have access to months and months of data that you could actually look across. And I'm curious whether you've been able to leverage that kind of data as an asset for internal learnings about your various channels, partners, internal staff.
The beauty about anything digital is most of it is measurable. We still are in the infancy and trying to figure out all the analytics that we can get. We do have defined measurements, but as far as speaking to them, I haven't seen the detail of the first measurement report. So maybe I can ask Julia to assist with answering that one.
Sure. Hi guys, if you're
Julia's
wondering,
in charge of measurement, by the way.
if you're wondering why I'm chatting about this, it's because I wrote the measurement plan. If I understand the question correctly, it's about basically, can we see all the data? And the answer is yes, we can. We can use a variety of tools. Most of them are free. It's not just because it's an aggregator, but it definitely helps. I'm trying to look at you and be polite, but also talking to the mic. So we can do that. I happen to like Hootsuite. It's got a good analytics platform. I've talked about it here before, but Google Analytics will. They sure are. But you can use Google Analytics in the way that you're talking about. So yes, it's true that Twitter, for example, only gives you a certain type of data. Facebook only gives you a certain type of data, and their insights, same thing with YouTube, same thing with basically any channel. But we can see everything, and we can tie it all together. So that's kind of the nice part, is that it still takes a human being to really look at all these numbers and say, oh, did we learn anything? What did we learn? How can we apply?
And so, yeah, we've already adapted from some of the things that we saw right away. We first started asking a lot of questions on Discus with too much context. They were too complicated. And we found by simplifying that, more people would respond. And, other ways by making sure that we're asking the questions on all our channels in our weekly newsletters and such like that we're getting more people to respond and that kind of thing. As far as our research centers and stuff, we've only been able to provide them with basic metrics such as, since being part of this strategy, how many more followers do you have on Twitter and Facebook and some basic stuff that we hope to be able to provide more of that in the coming months and years.
I think the challenge with metrics for all of us is there's so much that we could measure is what resources are we going to spend on measuring the most important things. That's we have to keep that in mind as to what we really want to accomplish. And for us, what we want to accomplish with the analytic strategy and the measurement strategy is to learn what's working and what's not working and adjust accordingly.
Denise.
First off, I want to say I really love the idea of using staff as a seed. I think that's really cool. I have a question about audiences. And so you've got an aggregator that brings multiple channels, targeting multiple audiences together. Have you found any challenges with doing that, having to speak to multiple audiences in that one spot? And if so, how have you overcome it?
Well, our staff, I know that our staff are also our patients at times, and there is a lot of cross-pollination between our various audiences that serves various purposes. But we have found more kind of channel-specific, where we're finding, our Facebook followers, I think we have about 2,000 or something. We have a lot more staff that are on that channel that are using that. So we communicate a lot of as well, profiles on staff or winning awards and that kind of types of content. And we know that that's working because some of those feeds get the most likes and most engagement. But as far as the strategy is kind of first start with staff, knowing that it is also open to outside. There's nothing on there that's is gonna, we feel put the organization at risk or, maybe it's not applicable to everybody, and so maybe they just won't spend any time on it. But right now we're kind of it's keeping it open. And as we move further down, we'll look at, can we customize to various audiences even more? The one thing I will say is for the crowdsourcing piece, we would love if we had an internal intranet that was available and accessible and mobile on your mobile technologies and stuff, and there was behind a firewall. We don't have that, unfortunately, so we don't, and I know you understand that as well. We do like that it's transparent, and I think for myself, if I were looking for a job and I was able to go into a place like Bloom to actually do my homework on the organization and see the types of people and the conversations, I think that's very valuable for me to see how the organization really is. So this transparency thing is, I think, very valuable. That's my long-winded answer, sorry.
Question? I'm just going to look at this from a very practical point of view, and I'm wondering if any of the hands-on staff, my doctor happens to be an emergency room nurse, 12-hour shifts, there's absolutely no time to get on there and find out what you're doing. I mean, they might do a little bit in terms of connecting with friends, but what they mostly do is sleep and do the, all the stuff that they're really pushed to do. And I wouldn't mind betting that the physicians and other people that are front line are not going to have time for it either, unless there's somebody in that department whose job it is to kind of collate the things that they might talk about between themselves and bring it to you. I can't see them actually using it, if that's what you're interested in, getting to the frontline people who are providing the care.
Okay, well, that's a good point. We have seen that frontline staff have been engaged. We're not going to engage everybody. We know that. There are some people that are already online and already looking at this stuff. And what we really need, and we're doing this, is leadership support, that it's okay during your working hours to look at your phone, your iPhone, your whatever device you use, your iPad, and use it if you're contributing to this. And as well as the leaders in those areas saying that, no, we have an expectation that you're going to contribute to this as well. Maybe you don't have to come to the staff meeting this week or next week, but instead let's have this discussion online. And the other thing I'll say is that there is a group of people that will check after their work shifts when they're not sleeping or whatever. A lot of people choose to work at Providence and other organizations because their values really align with it, and they're interested in this stuff and the healthcare off hours as well. And so when they're at home using their iPad or their whatever device and going to their favorite social media channel, they're not going to turn it off and say that's work, so I'm not looking at that. So, but again, and I appreciate that, but we are seeing that some of the new staff coming in as well that are connected all the time. They sleep with their smartphones and such.
But no, I just want to tell you how very pushed they are in terms of the hours of work and in terms of the material that they already have to deal with, plus all the charging. So, I mean, there's quite a large group of people that my daughter trained with in different areas, and I would say that very few of them, but this is at a certain level. Maybe you're talking at a higher level and an admin person can do it, but I'm just wondering if it's actually affecting the care that's given in a really significant way. That's just my point, my experience.
Yeah, the only thing I'll say to that is we hope that this will affect the care in a significant positive way by hearing from either the staff or the patients that have access to leadership, to our CEO who's seeing what's questions and stuff is coming in. And we hope that will influence change and make it a better care experience. So maybe it's pie in the sky thinking, but it is. We are seeing a lot of doctors and nurses on Twitter and on using this platform. I will say that it's nowhere near our 10,000 stakeholders, not even close. But we are only within a few. We are only within a few months.
But it's a challenge, that what you've put out to us is the challenge of making these Bloom or whatever channels we're using of use to those people. If those frontline workers found it useful to spend 5 or 10 minutes with it at the end of their workday, if they found it help them do their job better, then I think they would. And so it's only a few months old. That's our challenge moving forward, is to make it extremely useful to exactly those kind of people.
And you saw we did do surveys. That survey slide, nope, not that one. Somewhere. Yeah. So again, people that actually responded to this, and this actually, the biggest responders were nurses. And I'm happy to send those survey results around to anybody that's interested.
Question in the back. These digital media champions and Bloom champions can be very powerful. Have you thought about how to utilize and empower them to further your strategies a bit more?
So you're saying like the influencers, the people that are already really active? Yeah, we have, and we've just begun starting to do this more. But we know a lot of the people that are really engaged and online and talking already. But it's just now is our role, and what we hope to do in the coming months and years is to convince them that this is worthwhile and beneficial for them as well, and that they're going to get something out of this. And there are already people that are, but there are still a lot of people that still need further convincing why they should use their online clout to further the strategies of the organization and the patients and such.
Hi, Justin and Robin. My name is Brenda. I have Brenda Irwin. I have the privilege of being on the board of directors for Providence Health, and have recently been appointed the chair of the Innovation Committee, which may or may not be broadly known. And I just want to share for those in the room about the comments around pie in the sky and what really is going to be possible. I would like to just share that anything's possible if we figure out how to work together. I come from the healthcare investment space and a lot of technology and innovation, and what I heard today, a lot of great things going on internally, and I just want to share things like when you list the opportunities up there that include patient communities and patient engagement. There's so much potential in this community right now of other companies and technologies that we're hoping to bring in to work with people like yourselves. And so just as a throw it out there that definitely want to connect with you at the end and just let you know there's another channel listening, and we're really, it's a good group working with the foundation and some of the other institutes as well.
Great, and you could read my scripted note that you just read. Well,
oh, did it? Yeah.
Just joking. No, I knew you were coming. I look forward to meeting and talking with you more about this stuff.
We have just a few minutes left, maybe one or two more questions before we depart.
And anybody can contact me after. I don't know if email's anywhere on there.
Sort of the cover slide.
This cover slide.
No, it's not on there. Just your Twitter handle.
Tweet at Providence Health.
Yeah, just. I will say, I love Twitter, but at the same time, I have two kids under 3 right now, so I haven't taken full advantage of my Twitter channel yet. But just so if you go on there and say, hey, what's this guy talking about? He's got like 62 followers. Whoopee. So anyways, but definitely, I'm a follower, I'm a lurker, and have plans to get more involved.
So if I can just wrap up, sorry,
Yeah.
kick you off of here.
Sure.
There's just a few quick announcements I want to share with you before we head out of here tonight, and they involve holiday parties, kinda. So I feel like this is information that everyone is dying to get. The next evening rounds, number 13, Lucky 13, is a meetup on December 17th at the Mosaic Bar at Hyatt Hotel downtown, and it's from 5:30 to 7:30. And if you haven't been to one of our meetups before, they're really a great opportunity to hang out and talk to one another and to share ideas and just to connect with some of your colleagues and people from around the world of healthcare here in Vancouver. And it is a world because it's so decentralized and it's hard to meet people sometimes, but we all have a lot in common. So I encourage you to come out on the 17th. I thank everyone for coming tonight, Justin and Robin, especially for the talk and for the really great comments and discussion. And as always, you can continue that online, and we'll look forward to seeing you on the 17th. Thanks. Thanks, everyone.